statement.
Thank you, Madam Chairman. To our witnesses, welcome back to the Help Committee. I get the feeling that we may need to send smoke signals to you. I'm not sure we could have gotten you further away from us and everybody, but we're grateful to you and we thank you for your service to the American people. Each time you've all come before the committee, I charged you to look ahead the next 30, 60, and 90 days and figure out where we needed to be and what we needed to do to keep up with this virus. I'll say it again. You are the adults in the room, and you need to look around the corner to anticipate what we will need. More than 90 days from our last hearing, and we still have much to do to ensure that we're better prepared and better at responding than we've been in previous weeks and months. As we get closer to the 2-year mark of living with COVID-19, we need to take stock of the current state of our response and identify the next critical steps that will lead us out. Senator Murray and I have been working closely together to develop a pandemic bill, and at some point in the near future, Senator Murray and I will release a discussion draft of the reform, and we believe this is needed for our country's future response. I very much appreciate the ability to work together on an issue so important to our national security. We've obviously delayed from our previous schedule, but given the intent to appear on other big legislation, it is impossible for us to get that draft out until that's concluded. We need to use all the tools at our disposal to keep pace with the virus, which continues to evolve. Recent reports have surfaced of a new subvariant that some are calling Delta Plus, which has accounted for an increasing portion of cases in the UK in the past month. I hope to discuss that in person when I leave Sunday for the UK and spend some time in London next week to look at, in fact, what Delta Plus has done there. That mistake, cases and hospitalizations are down in the United States, but the administration cannot declare premature victory like we did in the summer. The mistake only brought us to a place we are today, with shortages of tests, therapeutics, and continued lag in extremely important data about the disease. In September, even CDC warned of shortages in point-of-care and over-the-counter tests, and to expect increased demand for lab-based testing. To state the obvious, we need more rapid tests that are available and in stock. North Carolinians are calling my office desperate for help in accessing therapeutics, and even with new announcements on oral therapeutics, Americans are waiting for these drugs. This administration bears 100% of the responsibility for the lack of testing and the lack of therapies. You got complacent, you let your foot off the gas, you didn't order enough tests, you didn't purchase enough therapeutics, and now we're rationing. The private sector will respond to purchasing agreements and to contracts. They cannot and will not produce things that customers are not ordering. Congress has given billions of dollars and billions more of dollars. We've demonstrated bipartisan commitment to giving you the cover to purchase vaccines, tests, therapeutics, even if we don't use them. The administration squandered time and resources you've already had available to you, and the American people are suffering as a result. As we look ahead, we need plans in place to handle COVID as an endemic disease that will be part of our lives for the foreseeable future. So my question and the headline for this hearing is simple. What's the plan? We need to take stock of lessons learned to strengthen our ability to be ready for the next threat that we may face, but also learn from successful approaches and put those into everyday practice. We need to identify information gaps and map out how we're going to address them so that we can make the best decisions based on sound science and sound data. Most importantly, we need strong leadership. We need a nominee for the FDA commissioner, and this administration cannot drag its feet on a new leader at the NIH. Both nominees will have challenging missions to complete under difficult circumstances and nearly impossible shoes to fill. Qualified, nonpartisan leadership at these agencies is paramount. Dr. Woodcock, I'm still rooting for you. We must leverage the laboratory community and test developers to bring more innovative, rapid, at-home, and point-of-care tests to market. We need not let our guard down as we did this summer. We're reaching the time of the year where we're all looking forward to spending time with loved ones, and access to testing will help this happen safely. But we're still behind. These tests, which we need to keep our businesses and schools open and families safe, are still far too difficult to find for most Americans. Testing shortages and delayed test results are keeping children out of school, parents away from the office, and limiting our understanding of where virus is circulating in our communities. The administration had to scramble to order 200 million at-home tests per month, many of which won't even be ready until December. And that's not enough. In early October, FDA announced that it authorized new tests to expand access to reliable at-home testing. Europe's been using these same tests for 7 months. Just this past weekend, my 2-year-old grandson was notified on Friday that his teacher tested positive. Teacher of a preschool class, masked 100% of the time that they were there. They did the appropriate thing. They shut the class down for a week. The problem was that his siblings could no longer go to school. School not only required him to be tested before his sister could return to school, but didn't accept an at-home test for a negative test for the 2-year-old. They required a PCR test. It's confusing. America does not understand the standards that we've set. And in that case, she lost 3 days of school, even though they could afford the PCR test. How many families can't? The American people are tired of accepting better late than never from our public health agencies. And the testing shortage will only get more pronounced if the Department of Labor issues its threatening temporary standard, which it did right before we came in, which will create an even larger demand for tests for those who don't choose to get vaccinated. One recent survey found that 59% of unvaccinated workers are still not likely to get vaccinated, despite the mandates from this administration. With the heavy-handed vaccine federal mandates on employers, this administration completely disregards the legitimate question raised by many Americans, and specifically Dr. Paul and Marshall. What role does natural immunity play in protecting against this virus? I've said before that I do not believe that the federal government mandates will solve our problem. We're seeing cops and firefighters quit and pilots engage in sick-outs. The nation's military and contractors worry about our preparedness if personnel are fired over these mandates. And just this morning, a mandate from CMS to all health care providers that accept Medicare and Medicaid, that if they don't mandate to their workforce, they're no longer participants in Medicare or Medicaid, will only suggest to doctors not to accept Medicare or Medicaid patients if, in fact, they choose as a medical professional not to be vaccinated. So there likely will be controversies over whether to require the vaccine for children, when even your own experts raise great concerns about mandating children get vaccines. I urge all of you, back away from mandates, and instead use your platforms to educate, encourage, inform. Don't be divisive. While more therapeutics and more tests are the tools that we need to manage the constant demands of the virus, we also need better information to make the best decisions. We need real-time data to understand and get ahead of COVID today, and to detect the next emerging infectious disease or public health threat in the future. So far, Congress has dedicated $1.1 billion to improve our public health data sharing and turn it into an actionable information through our surveillance system. But we still do not have the up-to-date and actionable data we need to answer some of the most common questions from the American people. Effective communication of information and data is the best way for the public health officials to win back the trust of the American people. And it's clear to me that the CDC has lost the trust of the American people. Show Americans the evidence for why the tough choices are the right ones, And don't just expect that compliance gets you there. Use the best information available at the time, even if it isn't perfect, and update action as the information evolves. This is a particular challenge for what is supposed to be our leading public health agency, the CDC, an agency that I have watched agonize over having perfect, clean data to make decisions for Americans. By the time we get their data, it's too late. We still don't have the answers to basic questions. We need real, usable information about masks. How well do different types of masks work? When should we use them? The CDC continues to change its posture on the collection of information on breakthrough cases. How many breakthrough cases result in hospitalization? How many do not? CDC is not in a place where the nation looks for real-time data, and we need to change that. The CDC is too focused on writing academic papers about something that happened weeks or months ago. When Americans want real data, they're forced to look elsewhere, like Johns Hopkins University or HHS Protect. I worry the new approach to HHS Protect will not be able to overcome the complacent academic culture of CDC without serious reforms, so I'll be watching very carefully. We must all come to terms with the reality the virus is here to stay. It's vital that the four of you sitting here today take the initiative to lead, empower Americans with data, tools, and clear and actionable guidance needed to get back to normal. The more people that get vaccinated to protect against COVID, the better. The more tests available to Americans to detect and diagnose COVID, the better. The more therapeutics we have to rapidly treat COVID, the better. The more we can continue to learn from this experience, the better prepared we will be. I thank the chair.
Thank you, Senator Burr. I will now introduce today's witnesses. Again, thank you for joining us today. Dr. Rochelle Walensky is the Director of the Centers for Disease Control and Prevention and the Administrator of the Agency for Toxic Substances and Disease Registry. Dr. Anthony Fauci is the Director of the